to our final presentation today, and that presentation will be by Dr. Arisegi Sarafadeen Adeniyi, who is a consultant in family medicine and researcher at NICRAT, the National Institute for Cancer Research and Treatment, Abuja, where he also serves as the National Cancer Health Fund Coordinator. He previously served as program manager for the National Health Insurance Authority at Usman Dan Fodio University Teaching Hospital, Sokoto. He holds an MBBS and MPH from the same university and is a fellow of the West African College of Physicians. With extensive clinical research and leadership experience, Dr. Arisegi has published widely and presented at major international conferences, including WONCA 2023 in Sydney and the 2025 West African College of Surgeons Congress in Bamako. And just before I'll call Dr. Arisegi up, I would like to remind us once again to please mute your mics so that we can have a wonderful experience. The presentations are supposed to last for 10 minutes each, so it's best that we make the best of our time. And we'll also be having a Q&A session immediately after the last speaker has spoken. Dr. Arisegi Adeniyi, thank you so much, sir, for your time. You have the floor, sir.
Yeah. Good evening, everyone. Please, can I have my slide, please? Yeah.
Before Dr. Arisegi comes up, I'm sorry to breach protocol. Please, Ian intact. You need to please or maybe the moderators should help them mute if they don't know how to mute. Please, it's affecting us. Thank you. I'm sorry to breach protocol.
Thank you, Dr. Otene. I really appreciate it.
So who is the host? The host can just mute everyone. It's very easy to do. Just mute everyone, or you mute me, I can mute everyone. That would make it easier. Because we lost almost half of Dr. Eberechi's presentation to noise.
True.
Yeah. Good evening once again. At least as I was introduced, my name is still Dr. Arisegi Sarafadeen Adeniyi. Because of time, I'll go straight forward to the presentation. We have only 10 minutes. So I want to take my presentation over this following outline: the background, the objective and scope of the program that is National Cancer Health Fund, the governance structure, the key highlight of the platform that we are using in disseminating the fund, and eligibility, application and selection criteria for the patient. Then I will also show a little the enrollment statistics from the inception to date, then the implementation status currently, then finally I will conclude. Please, next slide. Yeah, as we all know that cancer is one of the public health problems in our country. We know that the number of new cases, just like Dr. Udo said, we have about 760 patients annually, and about 540 patients die annually from the cancer. And the prevalence cases is about 269,109 that we have as a prevalence in the country. When we go down, we see the number of the males, the number of the cancers in males. We have prostate the highest, followed by the colorectal, liver, and so on. While in female, we have breast, cervical cancer, colorectal cancer, and so on. And all together, when you put them together in both sexes, the commonest cancer in Nigeria are breast, followed by prostate, then cervical cancer. And this one is what informs the choice of only 3 cancers that is being supported currently by the NCHF. Please, next slide. Yeah, the what leads to this NCHF is because of the problem. What is the problem? The limited insurance coverage, as was said by Dr. Uko recently, for the cancer, which means patients out of pocket. And this resulting in many abandoning treatment. So as a result of this problem, then the response come, which bring the birth of the Cancer Aid Fund. The Cancer Aid Fund now, which is now Nigerian Cancer Aid Fund, was initiated in 2020 to provide vital financial support for cancer care. This was led by private sector coalition by Roche, with support from World Bank International Finance Corporation, Federal Ministry of Health, and currently, just about a year ago, was transferred to NACRAT to manage the fund. Next slide. Yeah, the SCHF have this as the objectives. The objective of the National Cancer Aid Fund is to provide financial support for urgent cancer patients, particularly those diagnosed with cancers, to cover the costs of diagnosis, the treatment, and follow-up care. Also is to facilitate access to high-quality cancer care services, including screening, diagnostic, surgery, chemotherapy, radiotherapy, and palliative care for eligible beneficiaries, and also to reduce the financial burden on indigent cancer patients and their families, which enabling them to focus on healing and recovery without the added stress of exorbitant medical expenses. These are the main objective of this fund. Next slide, please. Yeah, this fund provide all these services that is on this slide, which I've mentioned earlier. It's called about diagnostic, such as biopsy, imaging, imaging study, and laboratory test, or surgical intervention and cost of anesthesia, pre and post chemotherapy medications, intravenous fluid, and so on. Also, anti-cancer agents such as chemotherapy and requiring anti-targeted therapy. It's also this particular fund also aim as in plan that to buy the insurance for the cancer patient, because not all the cancer patients are under insurance. They're not, all of them are not under NHIA. So we have the aim of use this fund to buy insurance for comorbidity, that whenever the patient that have cancer, can also have hypertension, can also have diabetes, can also have any other infectious disease. So we aim that when we can buy the insurance for them, they can be using that insurance to take care for other comorbidity. Then it's also care for the palliative care services, which is used to enhance the quality of life for the patient with advanced stage cancer. Also radiotherapy, both external beam and brachytherapy, and other advanced radiotherapy treatment modality. Supportive care too, which include counseling, nutritional support, antibiotics, which will be covered under the supposed to be covered under the insurance, then pain management plan, pain management, and which will be including morphine. Next slide, please. Yeah, this NCHF is governed with this all these committees that you are seeing here, with government. They are the one that in the governance framework of this NCHF. The National Cancer Aid Fund Secretariat, which domicile in NACRAT currently, the Quality Outcome Management Committee, Independent Monitoring and Evaluation Consultant, Independent Audit Consultant, Navigation Program for Patient, National Cancer Aid Fund Advisory Committee. These are the people that govern this Cancer Aid Fund. This NCHF is implemented through a coordinated approach, which involving government agency, healthcare providers, pharma companies, OEMs, local and international partners, NGOs, CSOs, and community stakeholders. All of us are involved in the management of this fund. Next slide, please. Yes. Here, as I said, that this NCHF is being managed by platform. This digitalized platform is managed by an independent consultant and deploy all the facility providing the services, all the facility in the country provide the service for NCHF. This particular platform is deployed to them. The platform is integrated with the cancer patient referral and navigation system, with dashboard and central processing unit domiciled at NACRITE. So this is the picture of the dashboard and some statistics that will be showing in the opening dashboard, dashboard of the platform. I'll just put it there for us to have a look at. Next slide, please. Yes. This NCHF cover major cost of the cancer patients who cannot afford treatment. It enforces high standard by ensuring participating facility meet quality benchmark. We are not just, the facility are not just selected. They were assessed and be sure they have all the quality to provide the quality services to this patient. The patient navigation and referral are integrated. We are trying to integrate the navigation and referral are integrated into major health facility nationwide. What we mean by this is that the Cancer Health Fund is only domiciled in all the 6 geopolitical zones. And we notice that the awareness is very, very low. So we are trying to have a way of having this cancer center as our hub. And we have sub-hub and feeders. Primary health center, general hospitals, we are marking them out that they should be now provided whenever they have any patient suspecting cancer, they should be referred to those centers. Next slide, please, because of time. Yes. These are the criteria for a patient to benefit from this NCHF. The candidate must be a citizen of Nigeria. He must have received histological diagnosis of a cancer at any stage if a licensed provider. Not that anybody will just give you the result that you have cancer. It must be sure that this person actually have cancer. Mandatory documentation is NIN, application form, and medical and social record of that patient is very important. The patient must be vulnerable, that is social class 1 and 3, based on revised Oyedeji socioeconomic classification. Then the treatment to be done at NACRAT Pilot Center. I made the pilot center across the country, which are National Hospital Abuja, University of Benin Teaching Hospital Benin, Federal Teaching Hospital Gombe, University of Nigeria Teaching Hospital Enugu, University College Hospital Ibadan, and Ahmadu Bello Teaching Hospital Zaria. These are the 6 centers that you can access the NCHF fund. Next, please. Yeah. As I said earlier, there are those things that are compulsory that this fund covers, and there are those that are not covered. All of those that are covered is diagnostic procedure, imaging, biopsy, and code, they are covered. Surgery, chemotherapy, radiation therapy are covered. Cancer medicines, supportive drugs, pain relief drugs, all are covered. Medical devices like ports, tubes, catheters, and so they are covered. Insurance for comorbidity, which we have not been doing now, but it's one of what is covered. Cost tied to an approved treatment plan. What is not covered under NCHF are expenses incurred before applying to NCHF. You might have been diagnosed having cancer before you apply. All the expenses you spend before you apply is not covered. Non-medical costs like feeding, lodging, phone bill, etc., they are not covered. Cost of caregivers. Some caregivers may maybe you are coming to the hospital, you have to come with the caregiver. The cost that caregivers expend is not covered. And personal expenses that are not related to the management of cancer, they are not covered. Nigerian Cancer Aid Fund, that is NCHF, sir. Go ahead, sir. Next. Yeah, this is how we go about assessing. How do we assess this fund? We assess through referral navigation system. Anybody that have cancer should now refer to one of these 6 centers. At this 6 center, we are accredited facility. They will evaluate them. After evaluate them, then they will now the patient data will be uploaded into the platform. Then the MDT, the multidisciplinary tumor board of those centers, will review that patient. And also, socio-economic assessment of that patient will be done with social welfare of that institution to know whether they are qualified to be assessed, to assess this. Then, after that, after MDT review, they will approve. Socio-economic assessment will be done by social welfare of the hospital. Also, they will approve. After approval, then you send to CMD, the chief medical director of each hospital will now approve that patient. After approval from that one, that chief medical director, we are not going to sit in our end at NACRAT. That's where we are going to approve for new patients or the top-up. We have top-up patient, we have new patient. There are some patients that they apply newly, first patient. These are the new patients. And there are patients that have been there before. They've received some money before, then they still need money for order to continue their management. Because then they ask the top-up. We do top-up for them in our place. Yes, next slide, please. Yeah, so these are just the practical way of doing this. Visit the participating hospital, engage with the patient navigation. When you get to the hospital, there's an admin, there's NC, there's Nigeria Cancer Aid Fund admin officer in all these 6 geopolitical zones. When you get there, you engage with the admin there, you are now going to see a physician, an oncology that will assess that is actually you have this cancer. After doing that, you are now going to check to be sure, do you meet the selection criteria? Are you a Nigerian? Selection criteria? Then you have to comply with hospital. The way they do their process in National Hospital may be different from that of UBTH, may be different from that of ABU Saria. So you comply with them, but they are going to put you on they are going to put the patient finally on the Nigerian Cancer Aid Fund platform. Then you have to adhere to the treatment plan that the hospital or the managing doctor plan for you. Next slide, please. Yes, I'm trying to be more detailed about this because that's the main thing. We want all the patients to know how they are going to access this fund. Just like I said earlier, you apply. Cancer patient apply for the fund. There is a link that can link you to this platform. When you get this link, you fill all the information you're supposed to fill, your name, your age, your social status, and other things. But it's always advisable when you want to apply to see the admin, the Nigerian Cancer Aid Fund admin of that institution you are going to admit, so that they are going to guide you. Because if you select a doctor from ABU Saria and you are going to assess care in Abuja, it may be very difficult. You have to still go up and down to change that. So when you have the link, you apply on the link. It's better you liaise with the admin in any institution you want to apply. Then after that, primary physician will consult you, refuse He will review and recommend care plan for that patient. That's in that institution. So after recommending the plan, social workers, as I said earlier, will review the application to determine whether you are to determine the indigency of the patient. Then multidisciplinary tumor board will review application and recommend whether yes or no. Then the CMD review application and approve. While after approval by the CMD, NACRA review application also approves. Then the fund, the patient e-wallet, that's e-wallet for all the patients that is under the platform. The patient e-wallet gets credited with it's a minimum of 1 million naira, not maximum. It's with a minimum of 1 million naira, depends on the plan of the physician, or the primary physician. So, or the recommendation from the MDT, depending on the recommendation from MDT. The primary physician may recommend 1 million or 2 million, and then when MDT review, they can reduce or increase. But whatever get to us, that's what we review and approve. Next slide, please. Yes, that's how we can assess the fund. So this one, they are just some statistics update from from our platform. The total application as of yesterday is 5,840 patients have applied on that platform. The fully profiled patient is about 1,740. Yes, the reason why the disparity is much is that majority of patients apply. Most of the people that apply, they may not even have cancer. Some of them will not even complete their registration. Some people just started applying, they heard as a fund. They don't know what the fund is meant for. So many people just apply. Some people doesn't have cancer that we are dealing with, because in Nigerian Cancer Health Fund, the topmost 3 cancers are what we are supporting currently. And the reason is because of the fund. And these are the breast, prostate, and cervical cancer. So among those people that apply may not have any of these 3 cancers. So only people that have any of these 3 cancers that are approved. So the approved is about 1,740. The top-up approved by Federal Minister of Health before handing over is about 1,403. While the top-up approved by NACRA after handing over, that's exactly about a year ago, on 19th of August 2024, we have do the top-up for about 427 patients. They are already on the platform before, so we added money for them. So the count of patients per hospitals, that's so below, UCH, people that apply for UCH are 668 and so on. And then new patient approved by Federal Ministry of Health was this, okay, good. And then please, can you go to next slide? This one is just the status of the number of patients that we have on the platform. Please, can you go to next slide? Hello? Okay, good. Thank you. Yes, this also is statistics. A number of patients by COE, Center of Excellency. This is center that we have. They are Center of Excellency. By year, in 2021 that this program started, from University of Benin Teaching Hospital, only 70 people applied. University of Nigeria, 68 people applied. University College Hospital, 67 applied. National Hospital Abuja, 273 applied. While Ahmadu Bello University Teaching Hospital, 135 patients applied, and Federal Teaching Hospital Gombe, only 87 patients applied. That's in 2021. And that has been increasing over the year. 2022 is seen here, 2023, 2024, 2025. And distribution of cancer type. Each centers have different, each centers of excellency have, these are the statistics of the cancer that they applied for. You can see there are some other patients, you say others. There are some other cancer patients that apply. These are which are they are far more than the 3 cancers that we are assessing and we are trying to support. So the transactions on this platform, on this our NCHF platform, the transactions over the year is what we see in the order in the next table beside us here in the right side of the table. In 2022, we have only all in all, we have only 1,499 transactions. While in 2023, we have 2,301. In 2024, we have 4,506. And now, as of today, as of yesterday, in 2025, we have 4,419. It has been increasing over the year. Next slide, please. Yes. I think this slide, I needed to just give us a little background about this slide. That is why I just put this slide. We want to know that this is a very laudable, very good initiative of the Nigerian Cancer Health Fund, was actually established since 2021, and it has been managed by Federal Ministry of Health and Social Welfare. But it was last year, August 19, that this program was transferred to NACRAT. The Minister of Health then gave us the mandate that this fund, we have been doing piloting since 2021 up to date. We want us to now think forward. How are we going to increase the number of centers and the number of cancers? Because the aim of this fund is to cover all the cancers, not only these 3 cancers we have been attending to. As a result of that, as a result of this mandate, the platform manager will discuss the intention. We discuss the intention of how are we going to make sure we increase the number of centers as well as the number of the cancers. So as a result of that, the old platform they are using is not robust enough to take care of large volume of this data. So there's need for the update of this platform. Due to what happened immediately, we took over on 19th of August. That's what we started immediately. And that caused a lot of trouble. So when we took over, we phased our program into 3, phase 1, phase 2, and phase 3. In phase 1, that is handing over of the program management from Federal Ministry of Health and Social Welfare to NACRAT, which was done successively. Then establishment of the NCHF Secretariat at NACRAT, which was also done successively. Then onboarding of stakeholder at NACRAT and the original 6 Centers of Excellency, which we onboard them because the platform is now a bit, it is upgraded them. So we need to discuss, we onboard them to tell them the nitty-gritty of this platform again. We did that one also successfully. Then constitution of oversight committee with quality outcomes and standard committee, independent audit verification committee, which was also done successfully. Now, we review and resolution of initial program challenges also was done. Then the next is what happened in phase 1. That one has been completed and the program is going on smoothly now.
Good
the
evening,
second phase.
So sorry, sir. I just wanted to, yes, sir. Just to say that the time, sir.
Okay. This is just last slide, please. I'll just only. Yes, I'll finish now. Thank you. Yeah, the enhancement and integration that was supposed to be in phase 2, and phase 3 is expansion and strengthening of the program. The phase 2 is ongoing. Please, next slide, please. Let me quickly just tell you the problem we have and how we are able to solve them. Yes, these are the challenges we face. While we are doing this, our phase 1, the expansive data follow-up, the data that was required to be migrated from the old platform to the new was extensive and will require longer period to process, arrange, and prepare for the seamless migration to take place. To solve this one, this challenge, the IT team was able to design an in-house script to handle the data to be migrated to ensure it was executed faster and was more precision and accurate. Account migration and access all the data that need to be migrated by the user account on the old platform had been migrated to the new platform as well. Also, we think of this WhatsApp notification to the patient this has been paused because of the meantime. It has been called for the meantime because we are still reviewing what we can do. How this one will be. Okay, please, next slide. Yes, also part of our problems. Next slide, please. And the solution to it. Next slide, please. So, next slide. Last slide, please. Yes. In conclusion, the National Cancer Health Fund, National Cancer Health Fund or Nigerian Cancer Health Fund is a transformative model for improving access to cancer care for Nigeria's most vulnerable population. Through coordinated governance, comprehensive coverage, and strong accountability system, the fund is poised to significantly reduce cancer-related mortality and support the national fight against cancer. Thank you very much.